Prime Minister revealing plans for Abaco, the course of the pandemic uncertain, and hundreds of Haitian nationals repatriated. Good evening, everyone. I'm Leah Cooper with your JCN News for this Thursday, October 14th. The government must pursue rebuilding initiatives with a bias towards action. These are the words of Prime Minister Philip Davis, who adds that the government's reviewing a house building proposal to build 150 homes on the island of Abaco. The Prime Minister also reiterated his administration's intention to reduce value-added tax to 10%. He says this much during the Abaco Business Outlook today.
Several construction types are being considered, including modular and prefabricated housing. The prefabricated housing provides for a rapid factory to be built on Abaco, with the equipment brought in and people trained to operate them. This is just one cost-effective option.
Prime Minister Davis also touched on the fact that life insurance terms don't allow for timely payouts after people have gone missing, even when their absence is so clearly associated with a catastrophic event like Hurricane Dorian. And with that said, the Prime Minister says this.
We are reviewing this to see what interventions may be required, legislative or otherwise, so that people aren't forced to wait 7 years for a formal presumption of death after a disaster. Apart from the financial burden this imposes, the psychological burden is immense, and closure is not possible. This is a tremendous human cost in health and well-being. We know because these are the stories which Abaconians have shared with us, and this cannot be right.
He also says that his government is currently preparing to overhaul the national investment policy and revitalize domestic and global investment promotions.
The goal is to attract and facilitate high-quality foreign direct investments that bring real value to Bahamians and the Bahamas and to islands like Abaco. My government is also determined to empower domestic investors so that Bahamians can build more wealth. As we developed investment plans to build on the strengths of each island in the Bahamas, we will highlight the untapped opportunities we see within sustainable tourism, boating, sailing, and fishing, among other industries that need capital directed towards them. The new National Investment Strategy will seek to build on these strengths, but government can do none of this on its own. We need to work in partnership with all sections of our communities, and the business community has an especially important role to play.
Prime Minister Davis encourages businesses to be more than just good corporate citizens and partner with the government and with the Bahamian people at every level. Bahamian citizens have been complaining about the constantly changing policies increasing on interest rates on loans and now a decrease in interest rates on savings accounts and other fees and stipulations some commercial banks have been subjecting their customers to. In recent weeks, the Royal Bank of Canada has made two major announcements that have angered many residents. RBC has ceased to put $20 bills in ATMs, with the minimum withdrawal now $50, and they announced this week that there will be zero interest on savings and fixed bank accounts. Callers into Love 97's radio talk show, Issues of the Day with Wendell Jones, place much of the blame on the Central Bank of the Bahamas and call for action.
I thought that after yesterday, the information came over the Royal Bank yesterday, I thought the first Mr. John Roll from Central Bank would be happy to be on your show today to explain, exactly what happened and how it happened to the Bahamian people. Because Central Bank is the regulator of all of these commercial banks in our country, and they just seem to be running amok on their own.
Some callers were also critical of successive governments for allowing commercial banks to do what they describe as the rape of Bahamian citizens, particularly when it comes to consumer loans and mortgages.
Mr. Jones, when I saw that thing on WhatsApp, I really thought it was fake news. And Mr. Jones, I could tell you that our regulators, I don't know if they really know what their authority is or what they are able to do. But it is a colossal waste of time to even complaining about the central bank about anything.
Many of the callers are calling on the central government to address the concerns of the citizens in that regard. And many say they are now looking for alternative banking options. The Ministry of Health and Wellness releasing COVID data for Monday, October 11th and Tuesday, October 12th. A total of 92 cases were confirmed over on those 2 days, 70 on New Providence, 10 on Grand Bahama, 4 on Eleuthera, 2 on Abaco, 1 case each on Acklands, the Berry Islands, and Inagua, and 3 with the location pending. Confirmed COVID-19 cases in the Bahamas now at 21,815. Active cases in country now at 1,253, with 142 people in hospital. 127 considered moderately ill, while 15 are severely ill in intensive care. On Monday, health officials reported that 3 deaths that were previously under investigation have been reclassified as COVID-19 related. The unfortunate deaths, all residents of New Providence, include 2 females, a 47-year-old and a 73-year-old, and 1 male, a 67-year-old. The deaths occurred between September 27th and 29th. Total COVID deaths now at 608. 75 people recovered from the virus on Tuesday. Total recoveries are now at 19,791. And with that said, there is uncertainty in the course of the COVID-19 pandemic in Latin America and the Caribbean. Pan American Health Organization Director Carissa Etienne says there is a high uncertainty as she responded to questions on whether PAHO has any expectation as to when the pandemic will be under control in the region. PAHO has developed 3 possible scenarios that may happen over the next 9 months for the health crisis.
In scenario A, where vaccination coverage is low and the public health and social measures are not sufficiently implemented, we expect high rates of community transmission to continue, leading to continued high rates of hospitalization and deaths.
Dr. Etienne says these scenarios depend heavily on the public health and social measures and the dynamics of vaccination coverage. She adds that an alternative to scenario B is that countries have high vaccination coverage but low implementation of public health measures. These countries face periodic spikes in positive COVID-19 cases.
The best outcome is scenario C, where we have adequate public health and social measures that are maintained over time, and that is accompanied by high vaccination coverage, generating a situation in which hospitalization and deaths are reduced over time. But to achieve this outcome, we need equitable, timely, and affordable access to COVID-19 vaccines and related supplies, which include like cold chain and syringes. We also need effective implementation of national immunization programs. This requires financing at all levels of the operation.
Dr. Etienne says without timely action, COVID-19 may become an epidemic, and this is why PAHO's advocating for quick and equitable access to vaccines. PAHO continues to renew their call for persons receiving the jab and to adhere to public health measures. You're watching JCN News. Stay with us.